just pause here. If before reform you were in Massachusetts and you were a diligent shopper and you were looking for health insurance, you'd call up Blue Cross Blue Shield, you'd wait 10 minutes to get through to somebody on the phone, you'd ask them what they have. They have 17 different products, and you would be completely confused by these variations, you know, oh, the mileage plus saver gazunaplat, and the, you know, okay, so what is that? And you say, you know, come on, help me, what do I kind of need? Oh, well, we have 3 popular plans, sir, and, you know, you start a half-hour dialogue, you end up with 2 pages of notes, and then you call Harvard Pilgrim. And you go through the same rigmarole, and they have different products. And then you remember 3 different questions that you should have asked them, Blue Cross, that have occurred to you while you're trying to Harvard Pilgrim, and then you call Tufts, and then you call Aetna. And the end of the day or the end of the morning, whenever you run out of patients, you walk across the street or the corridor and you ask your neighbor, what do you got? And that's how we that's how we make a $3,000 to $15,000 a year purchase decision that affects our very personal being. And here's how you do it on the exchange. You tell them where you live, because that's a rating variable. The plans can vary their rates by geography, and also not all of our 9 plans are available in every zip code. Obviously, the size of the household you're buying for. When you were born, because that age is the primary rating factor and will be coming 2014 for small employers and individuals. And then, of course, when coverage begins, because guess what? The price goes up the longer you wait. So with that very simple thing that takes like 2 minutes to fill out, you get this intuitive, kind of obvious intuitive question. You'll notice that this is now, those of you who spend your evenings reading the ACA, this is now, you know, in the bill, plus being the federal government, they came up with platinum. We just kind of said, well, you know, what makes sense? What will people get? How can we simplify? You know, we can't talk about $2,000 deductible and 20% coinsurance and, you know, this, that, and the next thing. So we came up with bronze, silver, and gold, and that works pretty well. In this case, our theoretical shopper has picked bronze high benefit package, and you can see lots of things. They could have picked silver or gold. They could have picked all Blue Cross. They could have picked monthly cost below $300. They could have picked annual deductibles of certain. They could have picked any of these variables on the left. They picked bronze high benefit. And interesting is the range of price variation. These are virtually identical benefits. I mean, if somebody has 12 PT visits versus 15, we're not into their shorts. But, you know, the basic benefits, they're all the same. And there's a price variation of 50% here. Now I'm going to translate that for your employees. Let's say you're an employer contributing $200 a month for individual coverage at the bronze level. Your employees now face a choice of $42 a month that they contribute versus $181, a 4-to-1 variance. That's a pretty powerful price-driving mechanism, going to drive them, all other things being equal, to the $42 monthly contribution. Now, the benefits are the same. The networks are not the same. You know, there are other features. The brand's not the same. Interestingly, consumers do weird things. I told you we had these young catastrophic plans, and while the $381, the Blue Cross plan with the big brand that has 58% market share outside of the exchange, has only about 25% market share when it's spreadsheeted against lower price options in the exchange. So that's what an exchange does.